Hello, everybody. I'm actually going to tell you my story myself, so that's why I stopped Oliver. Thank you for that introduction. Oliver, right? Yes, I got it right. Thank you to Keith and the Lifespan organization for having me here. As I know that it's one of the oldest, not oldest, but one of the OGs in the longevity space. So I'm very happy to be at their first in-person conference to talk about the opportunity in women's reproductive longevity. I've done this presentation many times, but I move it around, so bear with me. I'm just gonna test that. Yes, it works. So I'm going to start by telling you that I'm not a scientist. I started my career in a completely different realm, in the realm of fashion and design. So from that experience, I learned a lot of things about storytelling and brand development, and I work with companies like Louis Vuitton and Apple. Hopefully we get more people in here now. I also want to tell you that I'm used to doing presentations on women's health, and we usually don't have a bigger crowd, but hopefully that will change with time. In any case, when I sold my company, I was looking for something different to do, and I volunteered my dog to retirement homes and hospitals, and that's how I discovered what I call the aging space. I was shocked by how we end our days. I did a market study, I looked into the area, and I thought these people are all about the status quo. When I discovered longevity biotech, I was really enamored by the opportunity of rejuvenation and prevention. So that led me to running a very successful lifestyle newsletter, meeting a lot of the scientists in the field. I had the pleasure of interviewing Dr. Aubrey de Grey many times, Michael. It was all on Clubhouse. When everybody was not doing much, everybody said yes to an interview on Clubhouse back in the day. I met the AthenaDao crew, and I became a contributor. You heard about AthenaDao earlier today in the keynote presentation. So I became fascinated by that model, and then I thought we could use this for reproductive longevity. So AthenaDao, our goal is to be an organization leading translational and transformative women's health research. Why do we need this? Most people don't know, but we spend very little money on women's health. A lot of women don't even know this. 1% of all biomedical research goes into women's health research, even though we're half of the population. In decentralized science and in biotech, you hear a lot about the valley of death. So when it comes to women's health research, we're not even near the valley of death. We're literally at discovery and fundamental research. When you think that half of the world's population, we're not spending the capital that we need to keep them healthy, it's kind of a bit crazy. And then when it comes to longevity, I took this from my friend Nathan Chang. He did a presentation with HealthSpan Capital. And I was shocked when I found out that women's reproductive longevity gets its second last in investment dollars after pets. So yay for my dog, nay for women. Our pets are gonna get to live longer than women do. So I'm here today to try to make an argument for people, researchers, scientists, people here getting more interested in reproductive longevity. I love to reference myself, so Peter Diamandis did a tweet recently about how, we're so close to living to 100, 200, we're so close to life extension. Well, until my ovaries are not reversed in aging, I'm not gonna believe anything. Because when you think of it, we extended lifespan by 30, 40 years at the turn of the century, but women are still having menopause at the same time. So women are living a third of their lives with post-menopause, which is a long life to live with that compromised state of health. Oh, sorry, I went the wrong way. So the other part is, it's okay, we'll achieve LEV, but what happens for women? Is it going to be only men that are going to have reverse longevity? Do you guys want to be with your grandmas when you're all rejuvenated and young? And if that doesn't appeal to you, it's a massive market opportunity. The menopause market has been estimated at $600 billion. So not all women are going to have children, but absolutely every woman on earth will have menopause. The fact that we're not researching it, the fact that we actually have a lot of biotechs working in a lot of different programs to to extend lifespan or achieve longevity, but don't have programs that are focused on the ovarian aging or the ovaries, seems kind of counterintuitive to me. So at AthenaDao, I don't know how many of you watched the AthenaDao presentation, but the decentralized autonomous organization presents a unique opportunity to fund overlooked areas of research. And I've already told you in the last 4 slides that women's health is a massively overlooked area of research. Why is it interesting? Because you can get the right contributors and the right collaborators to work with you in different areas at different times. From the researchers, to the funders, to the community of women, and utilize blockchain technology to get all of this done. I keep looking up, but it's also down here. So we source and incubate women's health research. We have about 15 people on our science and deal flow group, which actually work with the researchers around the world to get some of these studies sent to us so that we evaluate them and then we actually fund them. I'm going to tell you more about that in a second. Obviously, blockchain, we're here at the Lifespan and Decentralized Science Summit, and blockchain is a very interesting way in which we can actually change incentives and create new pools of capital. Most importantly, most of you wouldn't know it, but there isn't really a very good hub of women's health research information available to women in general. A lot of women go to Instagram or TikTok to get their information from influencers. And though this is okay, it's actually exposing us to things that are not evidence-based or that are actually healthy for us. So our aim is to also create the most robust hub for women to be able to source information that is evidence-based and based on science. What we're fixing first, we started with ovarian aging because a lot of the DAO members were already involved in that field. We're currently doing our call for submissions for PCOS and endometriosis, and we're basically going to move along all the subjects in women's health by cohort. So after that, we're going to go to oncology. There are so many opportunities: metabolic health, heart health. We do it in this way so that we can evaluate the best science projects at any given cohort. So given that we started in August of last year, it's going to be our anniversary at the end of this month, I just wanted to go over some of our metrics so far. We already have our first project funded. We had our ceremony last week with Dr. Mario Cordero. You're going to see more about that. We did our first call for submissions on ovarian aging. We had about 50 projects submitted, and to us, it was a big proof of concept that we got submissions from very reputable institutions such as Harvard and Cambridge. We have 35 active contributors, and active contributors are people that put between 5 to 10 hours a week and do something with the DAO, whether it is science and deal flow, communication and awareness, governance, and tokenomics. We have a total audience about over 5,000 combined between our Discord, our Twitter, LinkedIn, and our newsletter. We are the second biggest, we have the second biggest exposure after AthenaDao, which was here earlier today. And we do a lot of education and advocacy. So we say that we bring advocacy and action together, but we try to make scientists available to our community. If any of you have startups that touch on women's health, we want to work with you. We want to expose women to real science and real products that can work for them, not just all that stuff that you see sometimes on Instagram or TikTok that will shock you. Oh, one last thing that just happened recently is that we do have a company that is right now under review. We're going to have a big R&D meeting because potentially we actually might also have already a company in the works that we are going to actually launch. So our first IP NFT, the way it basically works is like a sponsored research agreement, which goes into the blockchain. And if the scientist meets the milestones, the opportunity that is there for us to fractionalize that contract so that we can actually get more funding. The first project is worked on with Dr. Mario Cordero, and basically we are looking for targets to getting some new molecules in to delay ovarian aging, or more precisely, to extend fertility. This is a project that is very close to him because he actually had the issue of fertility when he was trying to have a baby. So it's really amazing when scientists actually do understand the problem at first hand, because they are more passionate about figuring out how to get this resolved. We also published 2 public goods, 2 reproductive health reports. You can actually, on the QR code scan, it says you to our website. Our first one was on ovarian aging, because we were doing the call for submissions for that. We have amazing interviews, like with Dr. Jennifer Garrison, that everybody knows works in the area of reproductive longevity. We did a 6-page report on the ARDD conference, which included a talk about animal models, what some of the biggest scientists in the space are working on. Our core team, because I already talked about myself, we have 2 scientists in the core team. Some of you might actually know Dr. Maria, some of the friends here do know some of these people in the community. Dr. Maria Marinova and Dr. Stefano Pinilla, they lead our science and deal flow team. And Ines Santos Silva, who has a lot of experience in pushing women in startups and innovation in Europe. The amazing thing about DAOs is that you can utilize the expertise of people at different times. So as I said earlier, we have 35 active contributors, but we come with a series of different expertise in the world of R&D, femtech, legal, Web3, and obviously science. And as you can see, collaborators from different DAOs can actually work together. You see Max, who is is part of the core team at AthenaDao, who also works with us, because he's actually interested in ovarian aging. It was Max who had the idea to say that we should have a t-shirt that says "Save the Ovaries." So we're gonna get on that. Yes, please, save the ovaries. So I want to put out there the notion that we would want to collaborate with people in the longevity space. I want to convince people like Yuri to do things on ovarian, cellular reprogramming on the ovaries. Basically, there are so many areas that we could be looking at that I don't think people are looking at, and there's a massive opportunity. I know from my years working in the fashion luxury industry how well women can spend their money if they have something they need or want. Proof of that is the Barbie movie, first movie to reach $1 billion in, I don't know, like the shortest time. Give women what they need and they will be your best customers. And give them something that actually is good for them. Imagine how far we can go. We have 2 more IP NFTs in the work. One is by Dr. Joshua Jackson. And the next one, which is very close to my heart, is by a PhD candidate working at Brian Kennedy's lab. He's somewhere around here, but he's been very supportive on this. Why it's very close to my heart? Because Lou is a PhD candidate. We're going to be able to get her funding way ahead of people who are scientists, they know how hierarchical science is, how difficult it is to get funding. And if we can actually advance science by putting capital in people that have new, novel ideas, we could potentially do much better. So in biotech, people talk all the time about the Bell Lab stuff. I was more of the moment and tried to do, we could be the OpenAI of women's health. So in terms of AthenaDao, we are looking to do it's not only the IP NFT and company creation, but there's a huge problem in data. Michael from Humanity knows all about that. We want to do something there. There's a huge gap in terms of actually having like as I said, information hubs with well-vetted and research data for women to actually know that they can trust certain aspects of science, because as we know, science took a hit after the pandemic. And more importantly, the opportunity from clinics, fertility clinics, to potentially even like the first biopharma company focused on women's health. I do want to announce, we already announced it to our community, but we are launching our token at the end of the month. We already have $250,000 from big supporters secured, and we hope to raise up to, I mean, it's not the frothy time of the year, but we know already the people that are coming to work with us with the funding, and if anybody is interested in having tokens in their hands, our big thing for us is making sure that women are also active participatories of the Web3 ecosystem, because we are replicating the same systems that we have in regular legacy institutions. I did put the whitelist, so if anybody is interested, you can actually do that now. It is something that we're doing for partners and friends. And if you join us on our in the whitelist, you'll get directly hooked onto or sent to our Discord, join our community. If you have ideas on research, if you have ideas on collaborations, we are very open to them. I'm personally obsessed with menopause, so anything that has to do with longevity or ovarian aging, I'm very receptive about. I mean, not that I'm not going to ignore everything else, but I know a lot about this field, so it's easy for me to actually understand a lot of the nuances about it. And that's it. Thank you so much. And hopefully we'll get some new collaborators from this. Any questions? Is there time for questions? Anybody has any questions?
Any questions on the audience? If not, I've got a question of my own.
Oh,
we got a question here.
Hi, I'm Alexei Polipov. What about the labs and the equipment? And do you have a community part that are head of labs that can provide equipment for the research?
You mean lab space?
Yeah, lab space,
yeah,
instruments, robots and stuff like this, yeah.
That's a very interesting, because I know one of the big things that sometimes is missing for the researchers is the lab space. So for sure, yeah, do join and we can talk about that. I know that a lot of academic institutions have done some sort of like hybrid lab space incubators so that researchers can actually do conduct the studies there depending on your location. So definitely interesting.
So we've been hearing a lot, and there's going to be a panel discussion later about biomarkers of aging, and there's certainly a lot of research regarding certain biomarkers of aging, such as methylation clocks, and using that as a proxy for age to determine your true biological age, and then using that to figure out if certain interventions could reverse that clock, and certain interventions have shown that you can do it, and you can reverse maybe all or some of it by a number of years. If you look at the methylation clock. So if these clocks are truly a full proxy of the aging process, and let's say you do an intervention, diet, exercise, supplements, whatever it is, and you take this methylation clock and it tells you that you've reversed the clock by your biological age by 5 years or 10 years, or it could be even just a few years, then in theory, based on what you've said here, I would predict that if that is correct, then if we take a cohort of women who just entered menopause and gave them whatever the interventions are that reverse the methylation clock by 5 years, all of those women should have their menopause reversed. Has anybody done a study such as this?
I don't think it works that way.
Well, I don't know.
No, it does not, because...
So we know that.
I mean,
all right.
I did learn from the methylation clock that Morgan Levine worked on that women's cellular aging accelerates by 6%. But as everybody knows here, the body is very complex. Just because you reverse one part doesn't mean that you're going to be reversing the other. And the thing is that the ovary is the factory of hormones for women. So there's like a whole other section that of biology that you're dealing with that will have to be dealt with. And I don't think the methylation clock reversal is the one thing that you can use to do that.
Okay, so the methylation clock is not an accurate predictor of menopause or that state?
No, there's
aging.
no predictor of menopause right now as it stands. There's no diagnosis. So women, technically, in the US, you will not be able to get HRT unless you've been 1 year without your period. That is too late to have HRT. And that's the only management tool we have. We have no way of predicting or knowing where women are going through menopause. We don't have biomarkers for it yet. And it's a huge thing because there's perimenopause. So women actually start going through the change, that hormonal change way earlier. So that's why we need to do the research that we do, because we actually, in order to mitigate all of the effects of menopause, we should know when it happens, but we don't.
Okay. All right, thank you very much.
Thank you so much, and have a great rest of your conference. And I'm around if you want to say hi or have any questions.
Great.
Oh, and we have a breakfast tomorrow at 8:30 at 8 in the morning, so come say hi, so if you haven't signed up. Thank you so much again.
Thank you.